This is Speaking of Pets podcast, where we give you up-to-date, accurate, science-based information when making decisions about your pet's health.
From experts in dermatology like my sister, surgery, internal medicine, CBD use in pets, the pet food industry, you name it. If it affects pets, we'll talk about it.
Today's Speaking of Pets podcast is sponsored by Blue Buffalo, the maker of natural pet foods. Love them like family, feed them like family. Blue Buffalo offers wholesome, meat-first recipes with high-quality natural ingredients in flavors dogs and cats love. Discover formulas for all breed sizes, life stages, and lifestyles. And with Blue Buffalo's True Blue Promise, that assures that real meat is the first ingredient, with no poultry byproducts, no corn, wheat, or soy, and no artificial flavors or preservatives. Hey, Janet, today we are so lucky we've got Dr. Karl Jandrey, who's a professor of clinical small animal emergency and critical care at UC Davis College of Veterinary Medicine. He started out as his undergrad at The Ohio State University and his veterinary degree from Ohio State University, and then went on to do a year internship at a very busy practice in Los Angeles, West LA. Lot of celebrity pets, which we'll have to hit him up for that. Then his residency in Northern California, moved back to Philly, where he became director of emergency services at a specialty practice in suburban Philadelphia and lecturer at University of Pennsylvania College of Veterinary Medicine.
Wow.
1999, moved back to UC Davis, where he is now the associate dean of admissions and student programs, and he teaches patient side in the emergency room and intensive care unit at the Pritchard Veterinary Medical Teaching Hospital at UC Davis. Wow. Besides all this, in 2004 and 2006, he was selected as the favorite small animal faculty clinician. So he's not only smart, he's tons friendly too.
What would Daddy say?
That's right. He's a smart cookie and he's such a cutie pie. He shares his life with another clinician scientist, a perfect yellow lab Labrador retriever, and many gallons of saltwater tanks, including vertebrates and invertebrates, and recently 2 adopted cats. So we have a lot to ask him about personally, and also those celebrity pets he saw at West LA.
Wait, what's an invertebrate? You mean SNAKE?
No, saltwater tanks, fish.
Oh, okay. Yeah. Well, the cat must drive the cats nuts.
Well, yeah, and I'll tell you, saltwater tanks are very tricky to maintain. You have to have everything perfect. Yeah. But I have to tell you a quick story. Speaking of fish, I was walking Hinkley Lake, and they're draining it to put a new dam in there. Well, as I'm walking by, something at 6:30 in the morning, something catches the side of my eye. It's a 14-inch long trout, struggling in the water to survive because it had been really dry and it was caught in the stones in the runoff. So I turned around to run the dog to the car, and I ran into this elderly lady whom I've never seen before, even though I've walked that park in 40 years. And I said to her, listen, I may need your help. There's a fish trapped there. Oh, really? I said, yeah, I'm going to put the dog in the car. I ran, put the dog in the car, got a towel and a shopping bag because I thought I could, And by the time I got back, she's walking in the middle of the stream with this fish.
Oh.
And
like walking it out.
Yes. Well, she's walking in the middle of the stream with her stones. So by this time we're under the bridge. Mike said trolls. We're 2 trolls under the bridge. And I grabbed, she said, well, what should I do with it? I said, well, let's go a little farther and we'll put it in deeper water, which deeper meant like a foot. And
so now you're in the water.
And as we walked, we got stuck.
On what?
Like quicksand. They had drained it, so it's all mud and silt. I put my foot in. I'm like, oh my God, it went up to my knee. I put my other foot in, went up to my knee. I couldn't move.
Like Tarzan quicksand.
She said, I was holding on to her so she wouldn't fall. She goes in up to her hips.
No.
And she said, what should I do with the fish? I said, go ahead and release him in the water. I managed to grab onto a tree, which luckily it didn't break off, like this, with my feet. She came out of the water, then fell, and she was down in all fours. So anyway, we managed to get out, and like I got home, Mike had to hose me off. I'm telling you. So then I said to her, "Do you want me to drive you to your car?" And she said, "Oh no, that's okay. I'm parked at the boat dock, which is halfway a mile and a half around lake." So anyway, we saved the fish. So then
But you had a mud bath.
yeah, so that was Tuesday. So Wednesday we had a lot of rain, and I ran into Bob, who I got to know from walking at the lake, and he was saving fish at 5:30 that morning, the same morning as we were. He went back 3 times and saved fish, but he didn't get stuck in the mud.
But maybe those fish didn't want to be saved.
It was like it was dying. It was flapping around and dying.
They're a koi. There's a koi. So my fish story is I was in San Diego on a project and we're staying in a hotel, and all these people were like fish tops and shirts and hats, like parrot heads. It was, are you ready? Koi convention.
Oh, fish. I'm going to tell you something. Fish medicine is hot. It's very hot. But anyway, enough about my fish story, and which started it with Dr. Jandrey's saltwater tank. We are so happy to have Dr. Karl Jandrey today. Karl's not only a friend and a colleague, but a neighbor. He lived right down the street from my office in Ridgefield. So, Karl, it's so great to see you again.
It's nice to see you, and it's great to hear from all my former Ohio buddies. It's really awesome to see you all.
Aren't you proud to say Ohio native?
Janet,
I just love that.
I mean, it's a great place to be from.
Yes. We have had several questions about emergency medicine, and actually, Janet just lived an emergency situation. Do you want to ask Karl about that?
So my neighbor
Janet?
texted me because she knows my sister's a veterinarian and she knows she follows us. She knows what we do. And she said, what do I do? Ollie's her cat. I think he's 4. And all of a sudden he was hiding. And when they went to pick him up, he was, spitting and sounded like he was in pain. He was groaning. And so I said, well, listen, I've been listening to all these doctors and I think you should take him to ER straight away. So would you have done the same thing?
Yeah, of course. I mean, cat's totally misbehaving, totally off his normal, and you don't really know. So you got to go to people who know, right? And if it's nothing, it's a peace of mind action. You just say, I was worried. Okay, the professionals told me not to worry. They gave me some things to watch out for. I think that's still money well spent. But if it was something more serious, and I mean, I deal in a lot of serious in the emergency room or in the intensive care unit, you may need to go to another level. And that's a good thing you brought him in early rather than waiting, because I would have to tell you that sometimes waiting makes things worse or more expensive.
Well, and if he would have waited, Alice, what was wrong with Ollie? He had his bladder.
Well, he was blocked, Karl. He was blocked.
Yeah. So urethral infection is a problem. Yeah. That's a life-threatening emergency for sure. When you can't get urine from your body, it just builds up in your system because that's how you excrete waste. So the less urine that comes out of your body, the more the toxins and the waste products of metabolism and your diet and all these things, they just can't get out. So the risks that involve, besides the pain, they get very high potassiums, and that very high potassium can slow down their heart to the point that it stops the heart. So bad news. So urethral obstruction for sure in cats is a life-threatening emergency.
But then she brought him home, and the next day she texted me. She goes, I got to take him back because he was peeing blood. And it turned out he had an infection from the catheter. So they put him in. Actually, Alice, they said, is there any stress in the house? I guess there may have been because the kids were coming home from college and all that stuff. And so they gave him like a sedative. What do you call it? A sedative, whatever. And she said, now he's like lounging in slow motion. So he's like super chill right now. But he's recovered. He's home and he's doing better. Poor Ollie.
That's good. And the urinary catheterization is always a risk. I mean, you have to put in a catheter to uncover or dislodge the obstruction and get that urine out of the body. But at the same time, the bladder's been so diseased because the bladder typically is so distended. A lot of times, the first time we put in a urinary catheter, it comes out bloody right away, like blood. It looks like blood. I mean, sometimes it just looks like blood. It doesn't look like any resemblance of urine. So it's pretty important that those animals that have the really significant cystitis, the inflammation of their bladder, and then they have the urethritis, the inflammation of their urethra, which is the tube that lines their urinary tract to get urine out of their body. All of that stuff's inflamed, irritated, so they often have to be on pain control. They have to be sometimes muscle relaxants, sometimes sedatives, sometimes things to help their bladder relax, sometimes things to make their bladder squeeze better. Yeah, it's nasty. I would never want to be a cat with that.
Well,
That's
he had
for
to
sure.
stay 2 nights with that catheter, with the with the cone. So, but he's home and he's better. And
Yeah.
she moved the litter box up to the first floor for his convenience.
Yeah, I mean, besides the obstruction, we always have to think about what caused the obstruction. And when they talk about all the factors, it's unfortunately a huge list of potential factors that are big syndromic. Like it's not just one simple
Right.
thing. And you often hear people passing a kidney stone. The kidney stone comes from their kidney, goes down their ureter, and that's where they're super, super painful. The ureter is the tube connecting your kidney to the bladder. And when it moves through that very small tube, it hurts. People get wicked pain to the point where they're often buckled over or vomiting. Once it gets into their bladder, it's less of a problem because it's just hanging out there in a bladder that shrinks and enlarges based on the amount of urine that's going into and out of it. But then when that stone might be moving then out of the urinary bladder in through the urethra out to the world, there's more pain involved there. So sometimes these cats have these little stones that are a single solitary stone. Sometimes they have multiple little stones, but sometimes it's inflammatory debris. It's the cells that line their bladder. It could be minerals and other contents from their diet that are sedimenting, if that's a word, out into their urine. And that creates, like, if you will, hair in a bathroom drain that kind of water can go through, but it goes really slowly. And then when that hair in the drain or this material in their bladder is sludgy and it's going through their urethra, then their urethra is spasming because it's irritated. So it just keeps compounding itself. So it ends up with a full obstruction where nothing gets through. They're painful. Their bladder's on fire. Their urethra's on fire. And they have to be sedated, sometimes fully anesthetized to pass the urinary catheter. Catheter usually stays in for 24 to 36 hours while everything settles down. So that's just getting over the emergency. But then what started it? Why do you have so much sludge in your bladder? Why do you have this weird imbalance that creates a stone? Why do you have the inflammation in your bladder or your urethra? And sometimes people say, multiple litter boxes will help reduce that. Steady environment, no rapid changes in environment. Don't have big parties. Don't get new pets. All these things can upset certain cats who are very tenuous in their behavior. That inflammatory upsurge when change happens starts this snowball down the hill that creates an avalanche eventually. So it's diet, it's environment, it's how many litter boxes, it's boys versus females, because usually the boys have the longer and smaller urethras versus the girls who have shorter, bigger ones. So it tends to be more male centric as a disease just because of their anatomy. And when you think about it, cats have very small penises. They're just tiny animals. They're maybe 5 kilos, 10 to 11 pounds. And not a lot can go through that except watery urine. Anything else that's more cellular creates more inflammation and things get worse from there. So it's a complicated treatment because it's not just fix the obstruction, it's fix all the other things that went into creating the obstruction, which often reflects back onto husbandry and environment.
Well, she did put one of those salt lights by the cat food dish to kind of present this like calming. Yeah. You don't know about the salt lights? I'm not kidding. She really did.
No.
Yeah.
No.
A little
I don't know if it works.
Cat food dish. She thought that would be like soothing. I'm not kidding. And then I told her to add, because I learned from some of the other veterinarians we had on, to add a little more water to his wet food so he'd lap up more water. So she's on it. He's right across the street. I could have her, bring him over, but that might upset him.
Hey, Janet, tell her when you see her that she inspired me for the Facebook page that goes with our Speaking of Pets. I wrote an article about why you should never leave your cats alone and go on vacation, thinking, hey, they're independent. I'm just going to leave the litter box and leave enough food out someone always needs to be checking on those cats at least once a day to make sure there's a urine clump in there. Because like Dr. Jandrey said, like Karl said, if they don't go, that bladder fills up, could rupture. The high potassium puts them into heart failure. I mean, I know cats are independent, but not really.
Well, actually, we trade
you know what
cat care off. If they go out of town, I go over with my cup of tea in the morning and my newspaper, and I literally just sit in the house with the cats, for an hour or so.
Well, make sure you check that litter box, though, when you go over there to make sure that cat's going. And Karl, I think you hit the nail on the head when you said, hey, peace of mind. This cat wasn't acting like itself. When she'd touch it, it screamed. That's a red flag. Something going on there.
So are there?
It is. And there's a lot of red flags. You just don't know if they're significant or not significant. And if you don't know, I usually tell people, well, you either wait it out, give it a few hours, and then call me or come in now and let's just get it done with. Yeah.
Can I just add something? When I was taking care of my mother, who also lived 2-3 doors down from your dad, Karl, in that little house we bought her, never fails. Saturday night, I don't feel good. So I take her to ER. Well, when did you start not feeling well? Wednesday.
It's true. It's true.
Yeah. Anyway, just had to add that.
Yeah, moms are like cats.
Yeah. So and by the way, I loved your mom.
Yes.
Karl's mom was receptionist at Dr. Parshall's office, Janet. I used to hear her on the phone. She was so sweet with these clients, so patient, just a wonderful person.
She really had patience. At work, not necessarily at home, perhaps.
There you go.
That was her work face, right?
I mean, we all have them, right?
So, pet injuries in ER, are they seasonal? Like, do you see different things in winter versus summer?
I would have to say yes in general, but seasonality also is season dependent on the area of the country. Right. When you think about growing up in Ohio, we had snow and we had antifreeze, and we have lots more antifreeze poisoning because animals lick the radiator fluid that's falling out of people's cars. Sometimes here, I'm in Northern California, Lake Tahoe is only 2 hours drive. And there's a lot of people who put, oddly enough, radiator fluid, antifreeze in their toilets, in their cabins to overwinter them.
Yeah.
So when they come in the spring to enjoy the cabin, they're not skiers, they're more mountain hikers. So they come in the spring, open up their cabin. We've had dogs drink out of the toilet that had the antifreeze in it. God. So that's kind of a seasonal thing, but it's mostly to me, it's a cold weather problem. But here it's a spring problem because of the way people sometimes manage their mountain cabins that they don't go to very often in the really inclement winter weather. We have rattlesnakes here in Sacramento area. We have no rattlesnakes that are poisonous in Richfield, Ohio. So the season for snakes here are when it's hot. They don't come out in the cold. They like it when it's hot. So we usually have a end of March to October kind of profile of snake bites. If we see something that looks like a snake bite, but it's the middle of January, that'd be kind of weird. So we might pursue a different, more likelihood for a differential diagnosis. I would say that trauma is often more common in the spring. I chalk that up to people and their pets are much more out and about. They're much more active in their yards. They're much more active hiking. And sometimes sex hormones might get in the way, and these dogs and cats might be just running all over the place trying to do the wild thing that they're trained to do. And they're just running all amok in dangerous positions and running across roads and getting hit by cars. So I think spring is unfortunate. Today, it's a very nice day. It's only about 95 here. When it gets up to 100, 104 here in the Central Valley, we get a lot of heat stroke type patients, and those may not happen as much in a more temperate climate like you're talking about from Northeast Ohio. So yes, seasonality, geography, all of that stuff plays into different things at different times.
So I lived down in the peninsula in Menlo Park for 12 years. Mm-hmm. And I had to learn some things. Like when I would go out and garden, you kick the hose box in case there's a rattlesnake in there. And then one time we were backing out of the driveway, and it's not a gutter, but it's at the bottom of your driveway by the road. And I'm like, oh my God, stop the car. And it was a baby rattlesnake. And I'm like, because Alice, you know what we hate, SNAKE. And that thing, I was terrified. And we had tarantulas. Oh yeah, it was that part I didn't.
Black widows. We have a lot of black
and what's
widow
the one with the
spiders.
violin shape on a brown recluse? Which we have
Brown
those
recluse.
here too.
I think those are pretty much everywhere. Those are hard to find. Those don't usually. I mean, getting a good brown recluse bite is really rare, but cool when we get to see
I'm
them.
outside of New York now. We're supposed to get some kind of Chinese spider that has
Asian
4-inch
spider
legs.
4-inch legs. Yeah,
I haven't heard that.
You know, Karl, do you know Heidi Ward, my oncologist friend?
For sure.
Heidi's in Sarasota. And so Heidi, because when we have a problem with the dogs, Sanibel's like an hour and a half from Sarasota. So she will have people where the dog gets bit by a snake and they bring the snake in the pillowcase.
Yeah.
Do you have that?
No, most of the time our clients be like, I cut its head off with a shovel and I'm happy I did it. They're like, everyone knows the rattlesnake around here. They're like, it's just a rattlesnake, because
gosh.
I mean, in the town of Davis, not so much because snakes don't like people. They want to be out in the wilderness, but people who go hiking in the mountains, people who have farms. Yeah, for sure. If you're going into the shed in the farm, you make a lot of noise because you don't want to startle a rattlesnake because their defensive mechanism is just to bite and get away. So, we do funny things out here, people wise, just to my friends coming from Australia before they usually put their boots, their Wellingtons are outside their house. And before they want to bring them in all muddy, but before they go out and put their Wellingtons back on, they actually dump the boots out because there could be snakes, there could be spiders, there could be all sorts of things. And Australia is the land of many intoxicating animals of all varieties that will basically kill you and all your animals. So they're very cautious about putting their boots on. But that's the patterns that we do based on the neighborhoods we live in, right?
Do you have scorpions in Davis or no?
We don't. I think they're around-ish, but we don't really ever see them. They're certainly more prominent when you get towards the really high desert type places
like Arizona.
Yeah, we have the Mojave Desert in the southeast of California, so there'll be more scorpions there. And then when you get to the Nevada, Arizona, for sure, they got quite a few scorpions.
The antifreeze story is helpful because my friend Ann has a lake house here, and you close it down in the winter, and we drain the toilets and put that pink stuff in the toilets because it keeps the pipes from freezing. But I never thought, because she usually has a lab. She put in for a new lab, Alice, a new Labrador.
I know.
You were the referral.
You told me. Oh, she emailed me. Yeah.
Now I'm going to tell her because I never thought, because the dog does go to drink out of there, right? So I got to, never knew that.
Yeah, and if the pink stuff is, they have two different kinds of antifreeze. There's sort of the greeny one. That's the one that's usually ethylene glycol. That one's the worst. But the pink one is usually a different brand. That's propylene glycol. It's usually the one that they label more safe. It is more safe compared to ethylene glycol, but they're still both toxic. So you still have to treat them both very cautiously. That's a bad intoxication. You don't want to have to deal with that.
What other toxins can a pet find in the home?
Oh my Lord. Every medication that we're on, they get into the cupboards, you drop a pill and you don't remember. You thought it went down the drain, but it actually is under the bed. I don't know. We get animals intoxicated by their people all the time. Not just the medications that you find in the home, but it's also the medications people have that they're like, oh, my dog's feeling unwell. I'll just give him some of my X, fill in the blank. So I've had people intoxicate their own animals with products that don't belong in animals' bodies, to the point of some of them are bad and or kills the animal. I'm not lying here. They intoxicated their animal and killed it, basically. Or more commonly, they give them something they think is okay with people, but the dosages are completely different and the reasons to give them are completely different. So they give them an intoxication, but it's not life-threatening, but it certainly makes them sick and sets them back and makes my job a little more difficult. And it makes it probably another extra day or two in the hospital to come over those effects of just the self-medicated, the animal's not self-medicating, but it's the owner's medicating. Plants in your house are another big one. We love plants in our house. I can see there's plants in everybody's house right now. I can see over your shoulders, you all have plants. I have a cute little succulent on my window over here. We love plants around, but certain plants are certain toxic principles. Cats love to chew on little things, so it's often a cat thing. We love to bring people flowers for the holidays or Mother's Day or whatever, but lilies are cat killers. Every lily, every part of every lily that comes in your bouquet, from the pollen that falls off the stamen and the pistil, the leaves, the petals, the stem, all of that's toxic when it comes to cats and lilies. So we're like, oh, I got lilies, I got flowers. It's so lovely. People love me. And that your cat's super sick, barfing their brains out a day later. And it's hard to recover from those kind of things. So plants, and there's plenty of websites that people can refer to. Is this plant safe for animals? You can talk to a master gardener in your neighborhood, or if you really don't know. But again, it's like puppy proofing your house. It's like kid proofing your house. When they come home and they start crawling and want to get into every cupboard, you put the locks on the cupboard. You got to do the same thing for dogs and cats, because they're inquisitive, especially the little ones and the young ones, and the ones that are smaller, to get into tight spaces. Like cats get into places you never can ever imagine they do, and don't put anything anywhere they can get to it.
So
yeah.
And also, Janet, I remember too, Karl, about puppies chewing electric cords.
Yep. The way our power comes through our power cords, if the animals actually bite down on the cord, think of your nice slobbery mouth with your puppy teeth. You get the cord. Here's a cord. Okay, what happens? It burns right across their lips. We see them with burns right here in the commissures of their lips. And they, oddly enough, get pulmonary edema. So they have this electrical shock, which causes a local burn, shoots through their body, but the cells in the lining of your lungs and your airways all become inflamed. They pop open, and all that fluid starts leaking into your lungs. So they get respiratory distress really, really fast. So they need to come in fast, because they go from normal to really strange breathing. It's pretty clear that something's wrong. So people don't usually hesitate for that one. So yeah, cords are a problem. So this, again, that's a puppy thing. It's a smarter, older lab is never going to do that, but it's a little puppy just exploring their environment. They don't have opposable digits, so they explore through eating and smelling. And if there's something to eat or smell, they're going to do it.
Karl, I read that when a dog gets skunked, if they get skunked in the face, that they can develop heart issues a couple days later. Is that true?
Oh, I haven't heard that one.
Yeah. And it was like 2 to 3 days later, some sort of myocardial issue. And I can't remember, I think I read that a few years ago. So, I don't know if that's true or not. Now that you haven't heard of it, it kind of worries me that it wasn't true.
I mean, it might be hokey pokey, but I don't know. I don't know everything. There's new stuff happening all the time. So, I mean, I try to that's why I love my job. I mean, there's always new stuff to keep digging into and learning about. That's what life.
Yeah. On that same note, I would think you'd have to worry about the contact reaction to the eyes too.
Yeah, they do get a lot of ocular surface disease with that. Besides the smell, that's not happy. I don't know what it would do, and I don't understand how it would affect the heart. But maybe it's something happening, or you might have regional skunk problems.
True.
So is marijuana legal in California? So
very
are
much
you seeing pets who have ingested marijuana?
Oh my God, all the time. It's so fun.
It's always the roommate, though.
Well, in the old days, it was always the roommate, but now these days, since it's medical and recreationally legal, it's pretty clear. People come in and we're like, oh, wow, your dog has symptoms that are very interesting. What kind of things do you have laying around your house that he might get into? They're like, oh, this, pot, this. They just rattle it off like it's, like a piece of banana in their kitchen sink. People are very clear about it. And although at sometimes where we're like, this looks classic, like a marijuana intoxication. And then the owners kind of like looks around and they're like, I don't have any marijuana, but I wonder who in my house has marijuana. So it might create some
drama.
if there's someone on the down low having some marijuana in their house, even though it's legal, sometimes they're not fully telling everybody about it in the house. But yeah, dogs we haven't seen many cats, to tell you the truth. It's pretty rare to see a cat that eats a marijuana of any product. The brownies, the edibles, the oils, the just the plant itself before they roll it into a joint. Dogs all the time. And I don't.
What are the symptoms? What do they come in looking
Yeah,
like to
this
you?
is the fun thing, is because it's it's pretty classic, because every dog is going to have an array of these things and nothing else looks like this. So it's kind of a clinical diagnosis. We would love to test their blood or their urine for it, but it's so classic as a syndrome. We often don't do any testing. We just are like, you clinically look like a marijuana intoxicated dog. We're just going to call it that. And why would we spend money on the treatment or the diagnosis if it's pretty classic? So here's what they look like. Dilated pupils, apprehensive. You like go to pet them and they shy away, which is not typical for that dog's behavior. They're ataxic, so they're walking around like they're drunk, or flat because they can't move because they're so stoned. And the last one is urinary incontinence. They just dribble urine for no reason. They don't even know it's happening. So dilated pupils, apprehensive behavior, ataxic, drunk walking, and dribbling urine. That's so classic. It just shows up like that. And if you see it once, you got it. If you've never seen it before, you're like, I don't know how these all fit together.
Wow.
But it's very interesting, and it's quite a rewarding intoxication to treat. It's rarely fatal, which is actually good, but it might keep them in the hospital for monitoring and hospitalization. That helps nursing care because they're sometimes bouncing all over the house and they need to be confined a little bit. There is an injection of a type of fluid that we can use that's called a lipid solution. So it's a fatty solution. It's got a composition that we often use in intravenous nutrition, but because the marijuana, it's THC, so all of the breakdown products of the marijuana, the toxic products, tend to be fat soluble. So we give them this lipid solution intravenously. It helps actually suck the lipophilic, the fat liking chemicals to it. And then the body processes those combination lipid THC products, metabolizes intravenously, and they get over there through different enzymes in the blood, and they get over their intoxication much more quickly. So sometimes we hospitalize them, put them on this IV intralipid solution, and do a lot of nursing care and monitoring to make sure they're safe and clean, because they're urinating all over themselves. It's kind of a mess. So it's often just one night in the hospital.
Okay, so how does fentanyl affect dogs?
Oh, it's a great narcotic. We use it. We've been using it in veterinary medicine for a long, long time. It's an excellent pain control drug, but if you give enough, you can certainly be somewhat anesthetic. We use it in a lot of anesthetic plans. We use it in a lot of sedative plans. We use it a lot of post-operative pain control. It's great as an intravenous continuous rate infusion. It's a liquid. We have mostly a liquid. We don't have oral fentanyl so much, but we have fentanyl patches, which are these little like Band-Aids that are transdermal administration. So you slap them on a fairly unhaired skin of an animal, or you shave it, and then you can get transdermal fentanyl. People have transdermal or fentanyl lollipops for oral pain. There's probably some kind of tablets that are out there, but we mainly use an intravenous solution, and it is excellent. It is excellent for pain control. It's a beautiful narcotic to use.
So what's the difference between fainting and a seizure?
Oh, okay. So a seizure is actually a disruption when your nerves aren't talking to your other nerves. So it's actually something intracranial, so something in your brain that sets off disruption between your neural signals, between neuron, synapse, another neuron. Something's going on with this connection. So it's usually CNS derived. A seizure has to have the patient become unconscious. They're out. They're not knowing what's going on. They often have tonic-clonic, so jerky, flailing motions, and short-lived, 20 to 50, 60 seconds. They often will drool, they might urinate, they might defecate. And after that seizure is over, they are shocked. They're like, what the just happened? They're mentally going, I have no idea what just happened. Why am I covered in urine? Why did I poop on myself? Like it's a true seizure checks you out from reality and then brings you back in, and you're kind of drunk for a little while. In that post-seizure period, everything is starting to reset and you have to get back up. So it usually takes 20 to 30, maybe 40 minutes to look normal again. So a seizure can be derived from, it's an intracranial problem between your nerves, but it can be driven by more than just things wrong in your brain. It can be driven by electrolyte derangements. It can be driven by chemicals in your body that your liver or your kidney are not processing appropriately. Certainly intoxications can cause a seizure. Long list of possibilities. Fainting. So fainting, the fancy word we use as veterinarians is called syncope. So when you faint, people faint for a lot of different reasons. And if you want to talk about narcolepsy, that's a different thing altogether. But when you say fainting, I think of an animal who basically loses consciousness, just falls over, and then just sort of gets back up and is like, I have no idea what just happened, because when I hit the ground, I kind of woke up. When we talk about syncope, that's usually cardiac driven in my world. So a syncopal animal is one who does not lose consciousness in our world. Usually, if their brain has not seen a good blood flow for about 8 seconds, there's not enough nutrition feeding your brain, and your brain is reliant on oxygen and sugar. Those are the two main things. All of our other tissues they have a bunch of different things that the tissues use, but your brain primarily uses oxygen and sugar. And how is that transmitted? Through pumping of your blood. If your blood doesn't go through very quickly, meaning your heart rate is too slow, you say, I don't have enough sugar, I don't have enough oxygen, boom, you fall over, you hit the ground. You don't have those tonic-clonic thrashing legs and seizure type activity. You might struggle to get back up. So people are like, they definitely were flailing their legs. I'm like, describe, were they trying to right themselves and get back up, or were they actually jittering and convulsing? So these guys with syncope often have a very strange heart rhythm. So usually their heartbeat is too slow, and their heartbeat being too slow doesn't deliver the oxygen that they need and the sugar that they need. And then they have this syncopal episode. It's short. They usually get up right away, but they're reliant on their heart to get back on track. If your heart doesn't start again, that's bad, because then your whole body's starved for oxygen and for sugars and all the nutrition. You don't typically die from a syncopal episode. Your heart just kicks back in and you keep going. Usually it's because of a pause in your heartbeat. This happens in people, and that's why we get pacemakers placed. We place pacemakers in dogs and cats all the time that have syncope. Wow. But it's usually because their heart has an integral problem with their conduction system that doesn't allow the heartbeat to start and move through the heart and transmit the energy to the rest of the body.
Can you do like CPR on a dog or cat?
Of course we can. Yeah, we have guidelines just like the American Heart Association has all of the guidelines for CPR that you can get trained for. And then you see all these automatic defibrillators now in bus stations and sporting events and maybe in grocery stores and malls. We have CPR we do in dogs and cats for sure. We have guidelines for that, and we are trying to train as much as we can all the caregivers so that we can continually do it better. And many of my faculty colleagues in emergency and critical care here and across the world are writing those guidelines and refining those guidelines. They're going through their second rendition right now.
I have 2 questions, Janet. One for Karl. What breeds do you see that maybe are predisposed to heart problems? Mm-hmm. And talking again about seizures, if your dog has a seizure, should you immediately rush it to ER, or what's the protocol when your dog has never had a seizure and all of a sudden it has a seizure?
Great question. I would have to start. Let me start with the second question. Seizures. Okay. Yeah. One seizure, isolated, never happened ever before. and your dog is young, less than 5 years old, any breed, you potentially can wait to go to the vet. There's a higher likelihood to be idiopathic epilepsy, which means we don't know what is caused. All the testing will come back normal, but we're not going to treat it yet because it's one isolated incident, and we don't know if it's one isolated incident or it's going to come back or not. So if it is young, otherwise healthy, isolated incident, recovers relatively quickly, probably don't need to see an emergency clinic right away, but note it down on a calendar, on your computer, whatever you use to keep track of it. Identify the date, time, and all the details about what the episode looked like, because you'll want to use that to compare for every other episode or to report it to your veterinary team. Why? Because if they get more frequent, number one, more severe, meaning last longer, or come in clusters, then you'll need to see a vet. Clusters mean many of them in a short time frame. Maybe it's a day, maybe it's a week. He had hypothetical situation. Dog X had a seizure when it was 2 years old. Never had a seizure before. Now it's 8. It has one seizure. Never again. Now it's 9. It has a seizure on Monday, a seizure on Wednesday, and a seizure on Friday. That's a cluster. I would get that dog seen, all else being equal. If you are a cat and you seizure, cats rarely have idiopathic epilepsy as commonly as dogs. So I would say if you're a cat and you have one seizure, I might have you seen much more quickly. So let's go over that again.
Great.
More severe, more frequent, or clusters. And I would love if you come to me and say, this is what seizure number 1 looked like. This is how long it lasted. This is what it looked like. They peed, they drooled. The second one, it was worse. It lasted 20 seconds longer. They urinated and defecated. And then the third one was only 20 seconds. I'd love all of that data is so helpful. That helps me so much when you can report the length, the severity, all the other things. Maybe you even know something that set it off or something that happened just before. Sometimes people come in and say, oh, my dog was wandering around the house whining. But, he normally only does that when it's like 4th of July with all the fireworks or the sirens going off when the firemen go by. But there was none of that happening. But, is that related? I'm like, it could be. That abnormal pacing behavior could have been some sort of wind up that was going, something wasn't firing right. And then all of a sudden it separated the link and then they had the seizure. So there could be some great information that comes from the pre-seizure period. And I also want to know what's happening in the post-seizure period. That post-seizure period tells me a lot. Like, how long did it take for them to get back on track? When did they actually listen to you and respond to their name? When did you think that they were looking at you instead of looking through you? All of that's really helpful. So that's, I think, my answer to your second question. Mm-hmm. Question number 1 was what breeds heart disease, right? What breeds are predisposed to heart disease? So, oh my gosh, every dog and cat I've ever deal with is potentially predisposed to heart disease. But let's just talk about generic. Smaller breed dogs older than 8 that are probably less than 10 or 20 pounds, about 85% of them will probably have a heart murmur, but about 15% of them will develop heart disease or heart failure. And the signs of heart failure are exercise intolerance. They just can't go on their long walks like they used to. Respiratory pattern changes. They breathe harder, faster, and much more like distressed. They might move their elbows out or move their neck while they're breathing. And of course, syncope can be a sign of heart disease as well. So strange breathing is the most subtle one that I think we'll be able to detect as animal owners. But there's not to say that big dogs are devoid of heart disease. I mean, we have had a rash of they had the grain-free diets that cause a lot of heart disease called dilated cardiomyopathy, and they generally were large breed dogs. That dilated cardiomyopathy can also be a breed predisposition. There are some breeds that are predisposed to getting dilated cardiomyopathy, and they're generally big to giant breed dogs like, Labradors, Dobermans, giant breeds like Irish Wolfhounds, and even Mastiffs sometimes. So There's lots of different forms of heart disease, lots of different dog type things, but cats also get heart disease. They get hypertrophic cardiomyopathy. You might, I don't know if anyone remembers Hank Gathers. He was a basketball player. He was a decorated collegiate player, but he collapsed on the court and died during a game. So everyone was like, how can a fit guy, so fit and so skilled, die? Well, it's because he has hypertrophic cardiomyopathy. People get this too. Your heart muscle gets so thick, instead of being like a normal heart muscle, it's like super pumped up heart muscle. So it's trying to work well, but because it's so fat, it doesn't leave a lot of room on the inside for the blood to flow. And because it's so fat, the conduction through that tissue is also weird when you're talking about the electrical signal that goes through the heart to keep your heartbeat normal. That's also disrupted. And many elite athletes have hypertrophic cardiomyopathy, and a lot of cats that sit in a sunbeam have hypertrophic cardiomyopathy too. We call it HCM for short, hypertrophic cardiomyopathy. HCM is in some breeds it's predisposed, like Maine Coon cats, and some of them have a mutation, just like people have a mutation in this heart gene. But similar symptoms, but exercise intolerance is hard to see in a cat because cats don't exercise. So usually it's the respiratory changes, breathing hard, breathing fast, moving their elbows, bopping their head when they're breathing, sometimes even using their belly to breathe because it's just really uncomfortable to them. So that's the most common heart disease in cats, hypertrophic cardiomyopathy.
Hey, did you know that for dogs and cats that could benefit from a prescription diet, Blue Buffalo offers natural veterinary diets formulated by animal nutritionists and veterinarians for certain dietary needs like kidney support, weight management, gastrointestinal support, and my particular favorite, dermatology. They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon-based for dogs and cats called HF. Contact your veterinarian about these prescription Blue Buffalo diets.
Do any of your human patients lie?
I don't know if I've catch people in lies.
Really?
It's an interesting question, Janet.
Like, I didn't put that chocolate out and he ate the whole bowl. You know, or, well, that Budweiser, I don't know, he just chugged that whole can. You know, I didn't do it.
I would have to say that they tend not to lie because they're paying me. And why would they pay me if they're lying? Munchausen's by proxy, maybe. Right. But I think that's probably not so common. I mean, being innocent to the fact that marijuana's in their house, that's a different story. They didn't think they had it.
Yeah. They didn't know. Yeah.
So when you were at West LA, and of course I don't want you to name names, I remember talking to you. You had a lot of famous celebrities.
Yeah. And we still see a lot of celebrities here at the UC Davis School of Veterinary Medicine too.
Okay, tell us who the friendly ones are if you're permitted.
Yeah,
you don't tell us.
You told me not to name names, so I'm not.
Yeah. We were talking about LeBron's cane corsos when he first moved in there. Now that he's in LA, I don't know that he has pets now. So,
but didn't his son pass out on the basketball court?
No, Kobe Bryant.
No,
I thought it was Kobe Bryant. Okay.
I thought Bronny did. No, Kobe Bryant.
But I thought his son plays basketball too. I don't follow this. I'm a veterinarian. I don't have time for pop culture.
Okay, so here's our question that we ask every guest. What is your pet human or pet peeve?
My pet peeve, if it's human or of the pets, my pet peeve is cats that pee in the wrong place. That drives me crazy.
Oh, there you go. Oh, that's the worst.
And guess what? My beautiful, perfect new cats, they're peeing in the wrong place on occasion, and I can't figure it out. So I've talked to my behaviorists, and they're going to come to my house, and we're going to have an in-home consult. Luckily, these are my friends who I work with, so we're going to try to figure this out.
We need to have the cat doctor. You need to listen to our cat doctor episode. It's all about the litter.
I mean, yes, I know. It's all about building a perfect environment so cats can pee. At least they don't need to worry about their poo because my dog's happy to clean them, which is gross. Is there a human pet peeve? Do I have a human pet peeve? I can get political here, which I probably should. But I mean, my pet peeve is for people is like, sometimes people need to let people be people and get out of their way and just let them do their thing and accept it. Like, it's okay to have differences. It's okay to have, completely different perspectives on anything, but you have to respect people's ideas and their approach. And you can agree to disagree, and that's what adults do. But my pet peeve is when people don't actually want to listen to each other and can't be adult enough to have a discussion about, I hear you, but I don't agree. You heard me, and I understand you don't agree. Okay, we'll move on.
Yeah, it's a great planet, and we all have to get along. This has been fantastic. Thank you for all the information.
Oh, yeah, Karl, we love you. We want you to come back and give my best to Michael. Tell him don't answer my email, because he's going to know why I'm emailing him.
Oh, because we're going to get him on? Well, thank you.
We're going to talk about next time.
Yeah, Karl, miss you. Hey, Janet, it has been fabulous talking to Dr. Jandrey. I still have a million questions, so we'll have him back on again. But for now, this is Dr. Alice Novotny-Jeromin
and Janet Novotny-King saying thank you so much for tuning in. Don't forget to follow, share, love us. We love thumbs up. The more the merrier. Thanks for listening.
Bye-bye.
Bye.
Hey, thanks for tuning in today. We hope you found the science-based information provided helpful in taking care of your pet. Check out our other Speaking of Pets episodes wherever you get your podcasts.
We'd love to hear from you. So email your pet photos and/or pet peeves to contact@speakingofpetspod.com. Remember to follow Speaking of Pets on all social media.